I don't think there's another organ system that has more incredible life delights and victories, time cause for celebration, and at the same time be an organ system where there's such heartbreak and potential for damage to the participants in sexual activity. I know you're very aware that when people use their sexuality to hurt other people, that's not what the design is. You're designed for having sex, but in the right context and in the right timing. And so my appeal to you and the reminder to me in my relationship with my wife and with other people is that there's great potential for good and great satisfaction. And I make a choice, and I'm hoping you make the choice, to use your sexuality as it was intended by the Creator and to be a student of your spouse's body and be very careful, guard their uniqueness and cherish them. Yeah. Don't settle for counterfeit. There are so many counterfeits. The male loves to look at the female form, and I'm not saying that females don't like to look at a man's hunkiness, but men, we have huge responsibility to guard the originality and the sanctity of the woman's body. And if you do that over a lifetime, there's a great delight. The people who report the most frequent incidents or have the best sex and the most frequent sex are people who are in a monogamous relationship. And there's invitation to be intimate and not big demand. People who use pornography, there's an underlying dissatisfaction because it's a counterfeit. I'm saying, just like an athlete goes into training, you be a disciplined person. This is my suggestion. You be a disciplined person and guard the sanctity of that other person's body and be exclusive. Diseases don't happen when, or they're less likely to happen if you're exclusive and you do the sexual activity in the right timing. Okay? Well, bless you. This is huge. Yeah, we'll talk more in class about that. The reproductive system tells you, the way Carl Sandburg said it, a baby is God's opinion that life should go on. And that's a big reason to have reproductive systems. We have reproductive systems. We have sexual organs that are designed to have sex. It's an important part of life, the marital relationship. And so, yeah, may your sexuality be used for the good of the society in which you live. Societies where there is zero population growth or below are not as vital. And in fact, many Western societies are not replenishing their population, and there's a loss of vitality. Male reproductive system, I'm asking you to watch this video and ask yourself the question, is it the dad's testosterone or the son's that lead to this extreme behavior that you see expressed? When we consider the anatomy, the male anatomy, urinary bladder, the prostate envelops the urethra, and if the prostate becomes enlarged as a result of infection, and that could be as a result of bacterial or non-bacterial, or in an acute fashion, maybe an idiopathic fashion, this gets enlarged, it can restrict urinary flow, and that can lead to a man expressing great frequency of going to the bathroom, because every time he goes, it's such hard work. He doesn't have all day long to stand at the urinal or sit on the toilet, stand at the toilet. He's got to keep going back and back and back. But then when he needs to go, it's like, I've got to go now, urgency, and it's painful, and that's entitled dysuria. Men who live into their 5th decade and beyond are vulnerable, highly vulnerable, to benign prostatic hyperplasia, and you can see the difference between normal anatomy and a prostate that's gotten extremely large. It's not cancerous, but it's gotten big, and you can see how stenosed the urethra is compared to the normal side. There are medications that can be brought to bear on that, and there's also surgical procedures wherein the urethral opening can be increased. Indications for surgery include a person who's retaining urine, which makes them vulnerable to infection, incontinence, hematuria, and chronic urinary tract infections. Urinary incontinence can be effected or minimized through pelvic floor strengthening or training, or through reconstructive surgery. This particular prosthetic device, there's a little air pouch that pumps up the collar that surrounds the urethra. Take this collar down, empty the air out of it, and that allows the man to urinate. Pump it up, and it'll restrict urine flow, so that person would not be incontinent. Prostatic cancer is one of the highly occurring cancers in men. We know that it's endocrine mediated because men who are castrated, which means their testicles are removed, which means that there's not as much testosterone there, do not get prostatic cancer. Black males who are twice as vulnerable to prostatic cancer have on average 15% higher serum testosterone than white men. So it's a result of the endocrine influence of testosterone. In order to determine if the prostate is diseased, the digital rectal exam is utilized. The PA or the MD will palpate the prostate, only have access to this much of it. If it's smooth and rubbery and normal size, pass the test. This should be an annual test after the age of 50. If the prostate feels hard and fixed, and that person has hematuria, we need to suspect cancer and follow up with more tests. Okay. There's a blood test that can be utilized to indicate whether cancer is in place. It's called the PSA. Typically, men, the physician will try to talk you out of this because it's not way accurate. It can have a false positive, and we don't want to do anything radical, really, when it comes to even if the PSA goes up in the early stages of cancer. It's a very slow developing cancer. You don't want to have surgery unnecessarily because of the side effects of surgery. 70% of the men who have a surgical procedure for prostatic cancer become impotent. They no longer can have sexual relations. And there's a high possibility of incontinence. And so don't want to rush into that, need to be wise. 3 conditions of scrotal structure change in the hydrocele, the testicle, the vas deferens, and the epididymis are normal, but there's swelling in the scrotum. That's hydrocele. If there's a cystic mass right at the epididymis, that's called a spermatocele, And if there's dilated vessels, kind of like varicose veins, that's called varicocele. And on the PowerPoint, each of these conditions are highlighted. I want to go to spermatocord torsion. This is where the artery becomes twisted and tortuous. There's reduction in blood flow to the testicle that can result in infarction and necrosis of the testicle. If this is underway, this becomes emergent. There can be restoration of blood supply if there's a surgical intervention within hours. Typically, once the man realizes that something's going on, normally you have a window of about 4 hours. So that's not a 911 call, but that's an emergency room call. And you can appreciate the fact that there's tremendous amount of pain associated with testicular torsion, swelling, erythema, high riding testicle, nausea, and vomiting. The arterial supply must be corrected in a matter of hours. And then if the testicle proper becomes inflamed, that's a condition called orchitis. What causes orchitis could be a virus that's associated with childhood disease of mumps, the sexually transmitted disease syphilis, tuberculosis, which we've studied the caseations that occur as a result of the bacteria that causes changes in tissue and urinary tract infections. You can imagine what the treatments are. It's bacterial, antibiotics are used, it's an inflammation, then NSAIDs. Bed rest, you got to be quiet, let gravity not affect, and then also influence the scrotum toward the perineum with your underwear. Okay, so it would be an athletic supporter or tighty-whities. That'll get it done. If the epididymis becomes infected, it's epididymitis. Here's the testicle, here's the vas deferens. This is where sperm will collect and then go. If this becomes infected, it's very uncomfortable. And again, here are the treatments that you would expect, including influencing the testicles toward the perineum. And these are some of the causes of epididymitis. Frequent sexual encounters, not being exclusive, because of the threat of sexually transmitted disease and, well, I'll just say sexually transmitted disease. It could be the infection comes from the sexual partner, or it could be a worse like syphilis or, prostatitis, urinary tract infection, and iatrogenic causes can lead to epididymitis. And then testicular cancer is frequently occurring in the age group 15 to 35. High cure rates if it's caught. Well, that's part of the issue, because the testicle is not. You'd think that it would send big messages that there's a problem, but the person will become aware of this as a result of an enlarged testicle, not so much that it's painful. And highly correctable if it's caught. I really enjoy this cartoon where the patient is responding to the doctor and says, I gave it a healthy dose of denial, but it didn't help. And sometimes we just men, I think it's kind of us, everybody maybe, oh, it's okay, I'll just see how it is tomorrow, and we put it off. Infertility can be a result of low sperm count or cryptorchidism. The testicle develops in the fetus in the pelvis and then will descend into the scrotum. That's necessary for fertility because sperm cannot be generated at body temperature, and so it needs to descend. If it doesn't descend, not going to have babies. And that's it. So Lord bless you guys. Bye.